have a QA manager that on her office door she had a sign that said, if you don't have time to do it right the first time, how do you have time to do it over again?
That's a great.
Which was really good.
That's powerful.
It's
yeah,
really good.
That is.
And
I think we should all have that as our mantra, right?
Yeah.
And it doesn't have to be quality or even life sciences. I mean, that makes a lot of sense.
Anything you do.
Because Russ was in Peru,
right?
And he was so amazed with how they built an AI program. They'd have these mobile X-ray units because tuberculosis is an issue, and the AI not only would it identify very quickly, does this patient have tuberculosis? They need to treat that person immediately, but it is also detecting cancer.
Right.
I mean, that's really cool innovation.
Yeah.
Welcome to the BioTalk Unzipped podcast, where we unzip the stories behind medical progress by sharing the latest and greatest advances in biopharmaceuticals and medical technologies in a fun, entertaining, and enlightening format. And now your co-hosts, Gregory Austin and Dr. Chad Briscoe.
It's been a year, right, that we've been doing this?
Yes.
That I called you up and said, hey, will you be my guest?
Right.
And you became my co-host, and we're doing this together, and it's been a great adventure so far.
It has been.
Yeah. So today, what we wanted to do for our guests is really just kind of recap the year that we've had, what we've learned, what we've experienced, some of the cool things that we've heard from some of our guests, and some of whom are also our friends, which is kind of cool as well.
Right.
So let's get started.
Great. Well, I think one of the things that I really appreciated when you invited me to be a part of this, or when I kind of pushed myself onto your podcast, idea was embracing this idea of making it a casual conversation. So, looking forward to revisiting with you and hitting some highlights that we can share with the guests, and hopefully they enjoy it because they've enjoyed the podcast, or maybe they haven't watched them all. So I think there's some really good things that we can hit on.
Yeah, for sure. And I agree. And I'm glad that we kept this type of format, not made it overly formulaic, and kept it our own. Yep. So we get to bring in who we want to bring in, and we can add as much value as we can to our listeners.
Greg, so just getting into it, what surprised you the most this year? And I'm thinking like with the guests, like if there were a kind of an overarching theme or anything that jumped out that you didn't expect, or something you saw across all these varied guests that we had, what might that have been?
In terms of the way they responded, or the subjects they brought up?
Whatever you think. I don't know. Yeah.
I think, and this may answer another question, quite frankly, because there's one that touched me the most.
Yeah.
And that was Russell Grant. And when he came on, because his humanistic approach to this.
Right.
I listened to that clip over and over again, and I'll read it to you. He said, it was the beginning of his first episode.
Right.
I put it in the beginning, and there's also some short clips I have in there. Every sample is a person, a patient, a loved one, our friends, your family, my family.
Right.
And he keeps in touch with that. Yeah. And he went on to say, even as a tube, they're in a lab. They don't see patients typically. They're just getting fluid samples, right?
Yep.
Or a sample of some kind. So every tube in a lab is a person. They're fearful. They're asking the most important question maybe in their entire life, which is, am I okay?
Yeah.
And that got me right here every time. I mean, I got a little choked up.
Exactly. I think a mantra that we use, that I hear very much through my colleagues in the industry, is every sample is a human, a patient, a loved one. My friends, your friends, people will have probably been tested using things that I've done and my team has done and my organization has done to help them navigate their own healthcare journey. And the proximity, even as a tube, every tube is a person asking a question. They're fearful. They are, am I okay? We do no harm, beneficence. We do our best for that patient. But the patient first mantra and mindset runs deep, and once you've been touched by that, it's probably the only compass point that one ever needs in their career to make sure that you stay focused on doing the right thing by the patient. So when you say zealous, I can't think of any other way than doing the right thing for another human being. Many you'll never know, millions I'll never meet, but knowing that I've done my best within the confines of a wonderful company and enabling the patient to get the best outcome that we can provide them. And that kind of journey is one that I would pay every penny I've ever had to have again.
And I thought, for some of the skeptics that are out there,
right.
The ones that are like, oh, it's rigged, it's this, this vicious industry that's just out there to make money and they don't care. That's just not true.
Exactly. Yeah.
There may be some bad actors, and there are some bad actors, but people like Russ and you and a lot of the people that I've interacted with, people really care. And they've cared their whole lives, their whole careers. And as Russ Weiner said as well, he said, these people are staying up hours away from their families to get these drugs to market to help people. So I think Russell Grant put it in such a way that it really touched my heart.
That was my second line here. same exact quotes. I wrote it down. That absolutely hit me as well, and it's a theme that I've used in my day-to-day as well, to bring back to people, right? Stealing a little bit from Russ, which I don't think he would. I don't think he'd mind at all. And on that same sort of line of thinking, the other thing that really stood out to me, and it's why I brought Scott Schliebner on, was that touching rare diseases. And what I've seen with people who are in that rare disease space is incredible as well. Those people get so close to the patients in an absolutely unique way. And it's such a team between patient, caregiver, researcher, people running the clinical trial, people who are recruiting to be on the clinical trials, and then carrying that theme forward. We saw Russ Weiner leave when he left Takeda, and he ended up with Alexion leading rare diseases, which is an area he wanted to be in. And I hear that theme a lot from people in the industry, that they want to be in a space where they can really feel like they have that close, make a difference. So that's that was touching to me as well.
Indeed. Yeah. I thought you were going into the whole Bill and Melinda Gates Foundation, which he was before Takeda.
Oh man, Well, I think that's there's another one. Exactly. Yeah.
And I think we've seen a nice turnaround, in my opinion, anecdotally, over the past maybe 10 or 15 years, at least, if not more, where you have companies that are actually rare disease companies.
Right.
And Beno da Silva works for one of those. Right.
Yep.
And that's what they do. And it used to be, the evil empire, they won't go after rare diseases because it's not profitable enough.
Right.
But now we're seeing more and more of that. And with personalized medicine, that's okay. They can make it work.
People are finding a way.
Yeah.
They're finding a way because they care, and and that's where we want to be. And that's really amazing. How about, Greg? How about this is really a departure from that, but I'm glad we started there. Thank you. How about AI? So one of the things that we said in one of our first episodes, I think it was when we were having Stephanie on, we go, okay, this will be our AI episode.
Right.
And then we never got away from AI the whole year. So was that a surprise to you?
Yes and no.
Yeah.
It was at first, when it seems like this just keeps coming up over and over again. But the reality is, I think it was really exacerbated by ChatGPT coming out and becoming such a big hit and such a game changer in our day-to-day lives, and what the technology can mean in so many different ways, that it's not surprising that people are embracing it and finding ways to use it in drug discovery, drug development, or even in regulatory, or there was a conference I went to, there was a guy from BMS, and he was talking about how they've built their own closed AI system to look into, they're a huge company, right?
Yeah.
They get a lot of deviations in their manufacturing process, so they have their own AI system to be able to go and do research on the deviations and what's happened in the past. And so it's just becoming part of everyday life. It's getting to the point where it's like, well, it's almost crazy if we don't talk about it.
Yeah, right? If you're not using AI, you're not in any business these days, I don't think. So it's
you're not going to last.
You're not going to last, right? I think that is absolutely for sure. Yeah.
Yeah. Yeah. Well, it's funny because you mentioned that, because one of my questions for you is, what do you feel are one of the most salient or maybe most surprising common threads throughout all our talks? And AI isn't easy. We can't use AI. So outside of that, what were some of the threads that came through one or more episodes, or even multiple episodes, that you found really interesting or maybe surprising?
Yeah, well, with most of our guests, we've asked them that kind of cliched question of what would you tell your younger self, or some version of that.
Right.
And I think almost every guest, if not every guest, had some version of, and I'll quote Russ Weiner again, with embrace the fear.
Embrace
right?
the fear. Yeah.
Take more risks. I wish I'd put myself out there more.
Sure.
And it was incredible to see a group of extremely successful people. I think anyone who's working on a PhD or getting their degree or looking at their career ahead, I think almost anybody would be happy to have achieved what every one of our guests has achieved in their career. Yet they all said, we wish we would have done more. We wish we would have taken more risk. We wish we would have put ourselves out there. And that was just, we heard it from, I think, all of them. And I hope people take that to heart when they hear that. I have, even at, kind of in the, I don't know, I consider myself in the third quartile of my career.
Right,
so maybe it's the third quartile of life, but I think I could definitely embrace the fear.
Yeah.
So
agreed. I think that's a good advice for anyone, but I really hope these young professionals, these PhD students who may be listening to this episode, do hear that and start to, imprint that on their heart, that they will take it to heart and do something with it. Because a lot of young people, and I have a teenager who's 15, and so they don't listen.
Right.
We're trying to guide and so forth, and he's like, future David will worry about that, kind of thing. And I hope our listeners aren't thinking, future me will worry about that 10 years later. Well, maybe another 10 years, and then they're past middle age, are like, you know what? I really wish I would have done that.
Exactly. Yeah. And you've done a lot. You've had a lot of career changes and gone different directions. And so I think you've taken that. I think you've taken that to heart. And I know sometimes those things aren't things that you looked for, but I think they make you better, right? I had some changes that I certainly didn't look for, but I think I'm better for it. So maybe if I didn't embrace the fear, maybe the fear was pushed upon me at different times. Sometimes you're forced to either embrace it or crumble.
I never imagined myself chasing bad guys through the streets and swamps of Savannah, Georgia. But I did that for a few years.
I know.
And I wouldn't trade it for anything.
Right.
But it was a very interesting time in my life, for sure. Yeah.
That sounds like a novel.
Now, I feel like my career is more like Leonardo DiCaprio in Catch Me If You Can. Although I didn't do anything illegal.
Right.
But it's
not that anyone's caught you.
Right. No one's caught. But I mean, it's kind of like it's shifting on a dime sometimes to do something different, because that's sort of what the industry or the demands in our making. So it's like, well, this industry just tanked. I have to pivot. I was selling data center services right at the bubble, and the bubble burst. Like, okay, well, this company's going under. We got to pivot, and so did some different things there. And the only thing I really didn't embrace and do is starting my own company and going for that. I've done little bits of that and have kind of dabbled in it. But I think for those people like the Scotts of the world who have started his own companies and so forth, I admire that.
Yeah, for sure. What do you think about Andy Vick's? His commitment to raising all boats, right? Through his involvement with AAPS, through his, he talked a lot about training and mentoring and things like that. That was another one that really stuck out to me.
Yeah. I love hearing those stories, and it's what I've always felt about this industry is how I felt when I was in academia. When I was in graduate school, I had one of the best graduate advisors I could ever hope to have. Not only did he train me extremely well in writing and research and teaching, but he was just a great human being and super supportive. And I had this crazy ideological idea that when I got into business, it's going to be more like this, and
Right.
Not at all.
Right.
And so I think there's a lot of elements within the pharma biotech business, especially on the science side, that sort of emulate that.
Yeah.
And I wish other businesses or parts of the business would catch up to that. Because there's so much value in growing people that I feel like I missed out. There's times I just have to figure it out, whatever that is, because I don't have someone who has my back.
Yeah, it's an extremely collaborative and supportive industry, no matter where you're at, which I think we're very fortunate. I don't know any other industries well enough to say if they're like this, but I feel like in a lot of other industries, or maybe even in other parts of the pharma industry, it's much more cutthroat than what we see in pharma development space, right? And stepping out of my normal bioanalysis space, which I tend to think of, but really in the whole pharma clinical development, which I think that's really our podcast is kind of focused on that whole clinical development space. It's just we're all trying to help each other, and at the same time push our company forward. So.
And that's what I love about it, because the rest of the world, and I don't want to say every other company or industry is like this, but there are some that are pretty dark and difficult. If you want to, the extreme version of that, watch The Boiler Room.
Okay.
Or Suits.
Suits. Yeah, for sure.
Right.
That seems stressful.
It's like pretty intense.
Yes.
And you're always looking over your shoulder kind of thing. And I've been in a couple companies where you thought people were your friend and they did not have your best interest. And so you had to tread very carefully and qualify everything you said. Not fun.
Yeah.
No.
I
don't recommend it.
No, not at all. Not at all.
Good. Looking back, was there a topic that really kind of made you scratch your head, or you might have disapproved with, and you thought, I don't know about that, or I'm not really sure where this is going? Was there anything that you had a contrarian thought about, or was it, most of it I think we all, because people we know and all the science, but I was wondering if there's anything there's like, well, I don't know about that, or that approach.
Yeah, I don't think I have a good answer for that. I love the question, but I think, like you say, we had people that we're collaborating with and moving things forward. I'll tell you, but if I just said the topic and discussion that maybe tested my brain the most was just with Tom Hellicar here in December, because I love the topic. I think it's amazing. It does make you scratch your head. He's doing great work. He should do that work. It's not, as I put in my LinkedIn post, it's not ex machina or AI really. It's I'm sure he's using the AI tools in some capacity to do what he's doing. But the idea of making that digital twin, when we started asking about the math involved in the modeling, I want to know that. Right. But man, my head was cranking trying to keep up with that. Whereas we got into some deeper science with other guests, but in those cases it was science I'm more comfortable with. So Tom really made me think, and we're trying not to do a best of, but if we looked at what was the most science, maybe it's the most sci-fi, I don't know, the most head-scratching, the most out there cool science. For me, it was Tom. No disrespect to any other guest, but and to be fair, he was the professor that we spoke to this year, and I don't think we spoke to any others. So
no, that's not true. Jonathan Hill.
Oh, Jonathan Hill. Yes,
Jonathan he did some really crazy work as well. With the genome sequencing and how and the what was it called, the nanopore.
The nanopore,
that was another one for me. This is way over my head.
Oh yeah.
I don't even know how to bring this down to earth. But it was really interesting, the work that he's doing as well. And the opportunities to make really big differences in medicine and personalized medicine. But Tom's answer to the computational questions, like, okay, well, how does this math work? And it's like, well, it's like two different maths, basically.
Right. Yeah.
And you find a way to get them to communicate was the end of that. I was like, wow, that is impressive.
Yeah, that was impressive. And Jonathan Hill, you're right. Similarly, and again, that was tough for me because I felt like I should have understood it better than I did with Jonathan, right? It's like, okay, I'm an analytical chemist. I work in the PCR space sometimes, but it was very unique and very exciting, and loved the application, and I loved also when we were talking about Andy Vick, kind of raising all boats and that training and mentoring. His commitment to helping those students within the University of Utah it was University of Utah, yeah?
It was Utah or BYU?
Or BYU,
We'll fact check that.
Should remember that, yeah. Fact check it. You can
Sorry,
put a line
Jonathan.
on there. Yeah. but their commitment to getting people out and making them CEOs of their own company,
Yes,
you know?
Yes,
What
I was going to mention that as well. That is so cool. Students. They come up with the idea. They get the framework of, okay, you can come up with a problem to solve, and you get to use all this equipment, and you get our support. And when they came up with something really cool that actually had potential and that started to work, then there's like, okay, we're going to get you, there's some corporate funding through our partnerships. Right. We're going to make you CEO, and we're going to incubate this thing and see where it goes.
See where it goes? Yeah. That was really cool.
That was really cool.
Yep.
Indeed.
Yeah.
What's something you learned about yourself through these interviews that was interesting or maybe unexpected?
I felt like actually that I grew in a lot of ways over the course of the year with doing this process. I should go back and listen to a full early podcast because I think we got better at it.
We did.
And so there's that kind of practical learning. Yeah. But I also felt like I've learned to listen a little bit more, take some time, give everybody their space.
Yes.
Let somebody else be the star of the show. That's not something that's kind of new to me because with a big personality, you can jump in and take over, but it's not. Our podcast is not about us. No. It's about the guest and their story and what they bring, and so that's really something that I think I've learned a lot, and I think I've gotten better in my professional and hopefully personal life. Maybe I'm a little better listener. My wife might take exception, but she doesn't listen to the podcast. So
right.
I don't think so. I think I love that introspection because I hadn't done that sort of introspection until you asked me that question. So how about you? Where have you grown?
I have a very similar answer. I think I got better at asking really interesting questions. And you've done well when someone says, that's a great question. Because they're like, oh, that's cool, and I really want to tackle that, or that's really making me think. So I love getting that feedback and giving them the space and learning how to probe. And I think, quite frankly, and we did this sort of seamlessly for the most part, is you and I have learned this kind of dance of trading off. It's not scripted. It's not like you're going to ask the first two, I'm going to go for the next. It's just we kind of both have some ideas of where we want to go and things we want to learn from this person, and we just go for it, and it just works. And actually, Jamie, your son, mentioned that. He goes, I'm really impressed how you guys just trade off. It's really seamless. I'm like, you know what? That's true. We do, and we didn't really plan that. It just sort of happened symbiotically, and so I guess it was just meant to be.
That's cool to hear, and I forgot you had connected with Jamie because that was a conversation I wasn't a part of. So I think these relationships too, right? I mean, we've both met some new people.
Yes.
I've loved the conversations with people. I was thinking about Jim Shen. Who I maybe knew Jim better. I don't know if I knew him better, but maybe better than any of our other guests I knew before going in. I almost felt like I learned more about the guy I thought I knew best than all the other guests, which I really enjoyed. And I enjoyed meeting new people and learning more about them. And then in each of the conversations, I've said this a number of times, I listen to our podcast because I actually enjoy it. Not to see how I can get better, what I can learn, but sitting back and listening to it, I actually kind of relearn the material all over again, sitting there. So I feel weird when I say it, and I feel weird a little bit when I'm doing it, but it's part of my podcast cycle. So
nice.
Yep.
Nice. Same.
Yeah.
And I think going back to the threads question, there's two others. One, and this was a bigger theme than the second one I'll bring up, is leadership.
Yes.
And how, and it's the same type of thing, raising the boats. So it's still kind of connected to that. But there's the leadership And I think Russ Weiner had probably some of the best examples of all the different programs that he has built from the bottom up, and how much he loves doing that.
Yeah.
And I think his best evidence of success is that at least 2 or maybe 3 times in his career, maybe even more, where he brought somebody in, trained him up, worked with them closely, and they became his boss.
Yeah.
That's crazy.
And he thinks it's great.
Yeah.
Yep.
Yeah. Most people be threatened, like, oh my God, what am I doing? I must be failing.
Yeah.
And no, he's succeeding very, very well as a leader, mentor, coach. So I think that's really cool.
I ended up in that position early on in my career where somebody that had interviewed me early on, I ended up being their boss. And it was so awkward at first. And I remember this guy sitting me down and going, like, as soon as I got the promotion, right, he's sitting me down and going, Chad, I always knew someday you'd be my boss. And I was like, oh, wow, really?
Yeah,
I had no idea.
Yeah.
So that's pretty cool. So so I've been on that side of it, and this guy's still a fantastic mentor and somebody I call on. So that's really neat. How about Stephanie talking about starting her own company? Stephanie, that was
talk about taking a risk, and she didn't seem to. I don't want to say she didn't think twice about it. I'm sure she did, when you start your own company. But it seemed like just such a very logical progression for her to go from, Big Pharma wasn't the fit, clearly, to do that. But the ideas and solutions that she was coming up with to solve some of these data analysis problems and how to get there faster and helping people, it's kind of like, well, why don't you just start your own company up, and that was great, and she's been going with it for I don't know how many years since, a long time.
They're trying to think how, maybe 5 years or so, maybe longer than that. She's probably on 6 to 8 years now. Again, Stephanie, sorry, we should know exactly, but that's what this is all about. But and she's been somebody that has been a who was it that I can't remember? Was it Russ again who talked about having the different types of mentors, the coach, the mentor, or was that Jim?
I want to say that was Jim.
That was Jim.
Right.
And
that was a really cool introspection of you need, people who are your champions, your coaches, and your friends or something like that along the way. And sorry that I don't remember that exactly. I need to rewatch that
but it was real good.
That was powerful. That was really cool.
And Stephanie's I was thinking Stephanie is one that we were going through a number of career transitions at the same time, completely different sorts of transitions, but we talked a lot and really supported each other a lot, which is great. And I think that's, again, having that mentor is great, having that peer support, that person who's kind of standing on the outside who you can share. I shared a little more with her about some of the career changes I was thinking about making than I did with a lot of people, because sometimes you got to have somebody you trust. I always think you got to be careful with who you trust, but you usually got to just find somebody and rely on it. So
right.
That's really interesting.
And that is a very delicate balance, I think, of going to someone, having a trusting relationship, and hopefully they're trustworthy, right? They've earned that trust. And then having the courage to take the risk and say, okay, what can I do better? How can I improve? And that goes back to Russ Weiner, because when he would get people that say, how can I grow my career? Great. Let me tell you how you can get from here to where you want to be. But when people come into his office and say, okay, I want to talk about my career, how can I get promoted next? He's like,
go away, come back. I don't know that he said that, but that's kind of, but that might have been, that might have been what he said, right? Like, I'm all about, and I'm similar. I don't want to say I'm Russ Weiner, because I think what he's doing, what people he's developing is amazing. But similarly, I have all the time in the world for people who want to come to me and help me help them. But it's real hard if somebody just comes to me and says, "What do I do?" And just it's like, well,
gotta have an idea, plan, right.
So I'm just going to throw it out there because I know you're going to agree or disagree with me. But the funniest, the episode we laughed the most in had to have been Scott with True Lab, right?
Yeah, for sure.
Yeah. So
there's no question.
What do you recall from that episode? Because that one was, like I say, there was a lot.
I enjoyed that episode especially because I'm not a PhD, and it was one of the few non-scientists that we had on the show that I could relate to a little bit more from that perspective. The funniest part was actually your question, which was actually our best performing YouTube short, by the way, which was CEO in a hoodie.
I think we started something.
CEO in a hoodie. Someone shows up in an interview with a hoodie.
Yeah.
What do you think about that?
Yeah.
And he's like, good question.
5-yard penalty.
5-yard penalty. And that was a great line. It's like, it's not a deal killer.
The Chiefs.
Yeah, right.
Yep.
That was a good one. But we had a lot of fun with that. And I like the way it started because the first thing I mentioned to Scott was, hey, your career is a little unique compared to others. And he started nodding and laughing, and his trajectory was, I think, really cool because it started out with his dad having leukemia or multiple myeloma, I think it was, and how painful that was as a teenager. And by the time he graduated college, he's like, I don't want to even think about life science or any of this crap right now. And it was, I think it was too painful. And so he got into finance and banking and did Sage, I think it was.
Sage,
and built up that great company and did that, and then finally came full circle. It's like, okay, well, this is great. I'm proud of what we built, but I don't feel like we're really serving people, and I want to make that difference. And that's when he came up with the idea of True Lab and found the right people to help support him in that process.
Yeah, we were just talking about True Lab today at work too. Just with some of the some of the applications and things like that have really helped us out a lot. So
nice. Yeah, it's good. And it's funny in this day and age that clinicians and phlebotomists in clinical trials are still taking tubes and writing down handwritten notes on these things when we have barcodes and scanners and all sorts of ways to track things much more efficiently.
Without a doubt.
But we talked about that, and he said it's just part of the problem is they're moving so fast. There's so much on the line with these clinical trials. No one seems to have the time to stop for a second and say, is there a better way to do this?
And on the flip side, do you have time to not stop? Right. Yeah.
At some point, you got to say this process is actually killing us. We're losing 20 to 30% of our samples because of the process. We have to, so it really makes sense, but sometimes it's hard to see the forest for the trees.
Used to have a QA manager that on her office door she had a sign that said, if you don't have time to do it right the first time, how do you have time to do it over again?
That's a great.
Which was really good.
That's powerful.
It's really good.
That is.
And
I think we should all have that as our mantra, right? And it doesn't have to be quality or even life sciences. I mean, it makes a lot of sense.
Anything you do. Yeah.
As I get older, I realize, we have a finite amount of time, and clock's ticking.
Any other highlights you think of, or do you want to talk about future plans a little bit for what we might want to do in the future? Or?
Well, and before we get there, I think the one thing that also was kind of interesting, and I'm trying to remember the order now exactly how it went. It might have been, who was right before Tom? Do you remember who that was? Tom Helikar.
Before Tom.
Was it Mark? Was it Mark Arnold?
It was Mark Arnold. Yeah, it was Mark Arnold.
And I could be wrong in my order here because we talk about a lot of stories and a lot of different things going on, right? And we have our new news articles, and we talked about digital twins in the new news article, and then we get the digital twin guy. I was like, that's a pretty cool segue. We didn't even plan that.
That was, because you brought that up, and I'm like, I know that guy.
In fact, I think it was maybe a couple back. Maybe it was Jim Shin.
It seems like it.
And then I brought up, we talked about Tom Helikar. Like, we need to have this guy, and we got it.
I'm like, I know that guy. So
that's pretty cool.
That was a really good one. That was a really good one. So and I think the other guy that I think we touched on all of our guests, and we didn't talk about Chuck, right? And we just you've clearly made a new friend, right? With Chuck, and that's really cool. But his founding of his company is a fantastic story. But then again, we find out the humanity in so many of these guests, and Chuck's commitment to helping his employees in Ukraine and his story with that, and now in Poland is just another story of we run these businesses. We're trying to make a buck and have a great career, but along the way we have an opportunity to make a difference. And Chuck's no Schindler, I guess. I was like, should I bring that comparison? But he moved a whole group of people out of harm's way in a war, which is really amazing. What a difference he made.
That was huge. And his leadership is so cool. It reminds me of like Simon Sinek, Leaders Eat Last, or that famous line about don't do anything or don't make someone do something you're not willing to do.
Right.
And there he was. He wasn't just helping these people get out of harm's way and continue to work and to do things for their clients and their patients and so forth, but he was making them dinner. They're getting together and they're having a big dinner together and making sure things are moving in life, not just in his company. And I love hearing those stories because we need to hear more of that because it's happening. But it's maybe not as few and far between as we think, but it's not as often as I'd like to hear as well. Right. And people need to have that as an example, an inspiration of how to motivate people in the right way.
Yeah. I agree. And Jason Burke, he might have been an example of motivating people in the right way as well. And I say that in the context of he's so knowledgeable and interesting with the areas that he's been in and all sort of having this underlying technology theme, but moving across and through different areas and going into the healthcare system to learn about that and see what he can do and what a difference he can make and grow, and then coming out and doing a variety of different things. So he was kind of in that space as well, where both tested our brains, I think, with some of the stuff he had done and just always with kind of the right mission in mind. That was maybe one of the things that stuck out.
Good
with
point.
Jason. So
well, and I think having the right mission in mind is also another common thread that just occurred to me when you said that across everyone we talked to. Because they're trying to make the world healthier, to help patients, to help people, help their employees, help grow young people, all of it. He's a brilliant guy.
He is.
Jason.
Yeah.
Good stuff. It's been a fun year.
It has been a fun year. Do you want to talk about some ideas for the future, or we'll see what comes to pass, right?
Right.
The good thing about this is we haven't been locked into anything, but I'm really excited about the two ideas that we've had, and we'll see what else we come up with. But this idea of building a series, and I'd love it if people are listening and want to comment or DM us. But this idea about doing a series on drug development, where a number of guests, we kind of follow guests through the drug development process and see how one builds on another, I think would be really interesting. And then another area that I'm really passionate about is global drug development, and how does drug development differ from geography to geography. I mean, I know almost nothing about drug development in South America, in Africa, and I'm sure there's efforts ongoing. But it's completely different. So I think that'll be really interesting if we can get to both of those kind of broad topics.
So I'll touch on both of those. But since you just mentioned the global, it reminded me of a couple of the conversations we had with Russ and with Stephanie, because Russ was in Peru, and he was so amazed with how they built an AI program. They'd have these mobile X-ray units because tuberculosis is an issue, and the AI not only would it identify very quickly, does this patient have tuberculosis, and they need to treat that person immediately, but it is also detecting cancer.
Right.
I mean, that's really cool innovation out of Peru.
Yep.
That's really neat. And then, Stephanie obviously did a lot of work in South Africa.
Right.
And it'd be great to maybe highlight and bring out some of those. Maybe even some of these might be a panel where we bring in, Russ and Stephanie back to talk as an episode.
I like that idea. I like that idea,
And because they both have such global reach on things that they've done, I think that could be a lot of fun. I love the drug development series idea, because that's how I sort of grew up in this industry. When I got started, I was recruiting scientists in drug discovery and development, and I knew nothing except that my dad had metastatic melanoma that got into his brain, and I wanted to learn more on what's out there that can help him. And so as I started talking to people, these candidates is kind of where I started, and getting to know really good people and trying to help them and get them fit with the clients that I was finding as well. Is I needed to understand the terminology, and they really educated me. They were so kind, a lot of scientists. I'm like, what is an MNR?
Yeah.
How does that work? Why do you use it? You know, what is mass spec and those types of things? And so I think I really understood from talking, if you're talking small molecule, talking to medicinal chemists, what their role is, how it starts, how the toxicologists get involved in animal studies and first in human, and each part along the way. And then you have the bioanalysis part looking at, well, this is what you really have. You think you have this, but actually this is what you have. We need to make some changes in the design. I think that would be great fun for the people who are in it every day and they get it. And the folks that maybe work on one end versus the other and getting to hear a little bit more insights. And I think it'll also help the people who aren't necessarily doing this work every day, who want to understand, how do drugs get made? And I think it'll be a really insightful series. So let's bring that.
Fantastic. Looking forward to it.
Yeah. Good.
All right. Anything else?
Well, I think you and I could probably continue chatting for another 30, 40 minutes.
But I don't know if anybody can continue listening.
Right. So I would like to do another fun episode. Maybe it's a year from now, where we set up. And if we can't get together like we are now, maybe we do that just like we talk about in our trailer. You know, it's like having a beer after a conference where we have kind of a cocktail hour.
Maybe we need to do one. We need to do one at a bar.
Yeah. That would be fun.
All right, let's work that out.
We'll figure it out. Let's do it. We can do that.
Figure it out. We'll find a bar. Somebody will have us.
Awesome. Hey,
all right. Hey, thanks a lot.
Looking forward to the next year, man.
Yeah.
Season 2 is coming up.
Thank you. Yeah, and I think one other thing, we should throw a shout out to CREO.
Yes.
Because we're use their conference room to film, and they've been a good friend to me. Yeah, there we go.
A little
good friend
placement.
to me and a good friend to the show. So really appreciate them letting us use their facilities here in Durham. So
great shout out.
Great.
Thank you to CREO and to all our guests. And looking forward to more.
All right.
Excellent.
All right. Thanks a lot.
All right. That's a wrap. Thank you.
All right. Sounds good.